Your sickle cell disease can produce symptoms when you are sick, such as when you have a fever or an infection, are cold, do not drink enough or lose too much fluid, do not get enough sleep, are in a lot of pain or stressed. But they can also occur without a specific trigger. Sickle cells are broken down a lot faster than normal red blood cells. People who have sickle cell disease are therefore almost always anemic. The extent of the anemia determines which symptoms you will have. Common symptoms include tiredness, feeling weak, shortness of breath, dizziness, heart palpitations, sweating, and headache. When hemoglobin levels are too low, a blood transfusion may be needed. If a sickle cell crisis leads to blockage in small and larger blood vessels, the oxygen in the tissue may drop to insufficient levels, which is called infarction. Infarction can occur in many places in the body and do temporary or lasting damage. A sickle cell crisis is painful. The degree of pain depends on what part of your body is affected by the crisis. A crisis in a bone, for example, is very painful. Hands and feet may also be quite painful and swell up. An infarction in the spleen, on the other hand, can go entirely unnoticed due to the absence of pain. The spleen helps remove damaged blood cells and bacteria, as well as fight infections. Regular splenic infarctions will damage this organ at an early age, causing it to start functioning less effectively. The spleen will then get smaller and have scars all over it. Reduced spleen function or even spleen failure will make you more prone to infections with, for example, encapsulated bacteria, such as pneumococci, meningococci, and Haemophilus influenza. These are potentially dangerous infections. The symptoms associated with infections can differ greatly, but they will also include fever, feeling sick, pain, such as a sore throat or headache, and reduced appetite. If your spleen does not function properly, you are more likely to develop more severe infections, such as blood poisoning, sepsis, or meningitis. The infections in turn lead to a greater chance of you having a sickle cell crisis. In some cases, the spleen suddenly swells up in response to an infection and fever, due to a large amount of blood to accumulate in the spleen. This is what we call acute splenic sequestration. It produces severe abdominal pain and swelling on the left side of your abdomen. Your blood count will also drop acutely, making you look pale and feel tired and/or dizzy. And it can also cause you to faint and have palpitations. In most cases, doctors decide to remove the spleen after acute splenic sequestration. Protection against infection through additional vaccinations and possibly antibiotics will continue to be needed. After some time, sickle cell disease can lead to a narrowing of the blood vessels in the brain. If blood flow is obstructed as a result, oxygen supply to part of the brain tissue may be reduced, which can lead to brain damage. This is called a brain or cerebral infarction. A brain infarct can have very different consequences. Some cases pass by entirely unnoticed, although they may still cause learning and concentration problems. After a severe infarct, you may have epileptic seizures or have problems with your motor skills. When sickle cells start to clot together in your blood vessels, you will experience severe breathing problems. This is called acute chest syndrome, which is generally triggered by an infection in the airways. Acute chest syndrome can occur very suddenly and be life-threatening. Symptoms include fever, coughing, chest tightness, chest pain, and oxygen deficiency. Acute chest syndrome may leave permanent lung tissue damage and decrease lung function. The accelerated breakdown of sickle cells leads to changes in the composition of substances in the blood. This may result in high blood pressure in the lungs, which is called pulmonary hypertension. It also comes with changes to the vascular wall. more smooth muscle cells take shape in the vascular wall and more collagen is produced. This ultimately leads to fibrosis of the lungs and contributes to the triggering of pulmonary hypertension. Pulmonary hypertension also affects the heart. The right ventricle of your heart pumps blood through both your lungs. When the blood pressure in your lungs rises, your heart muscle will have to work a lot harder to pump sufficient volumes of blood through the capillaries of the lungs. This extra effort may lead to a thickening of the right ventricle wall. If you have severe anemia, your heart has to work harder to continue to supply sufficient fuel to your body. This can also have an impact on the structure and functioning of your heart. One important function of your kidneys is to regulate water levels in your body, determining how much water needs to be retained for the body and how much can be discharged in your urine. Kidney tissue is very delicate. When sickle cells pass through the network of small narrow vessels in the kidneys, kidney tissue can get damaged. This will reduce a kidney's ability to regulate water levels and cause your body to lose more water. As a result, you will have to go to the bathroom often and urinate a lot. You will also wake up at night to go to the bathroom, and if you fail to wake up, you may end up wetting your bed. As your body retains less fluid, you will get dehydrated. Your blood will get thicker in consistency, and the chance of you having a sickle cell crisis increases. This is why it is important to drink enough. When your blood does not flow smoothly, bone tissue may die, which is called a vascular necrosis. This is very painful and means that you will not be able to move the affected limbs as normal. Upper legs and arms, as well as the bones in your back, are particularly susceptible to it. An aplastic crisis causes the bone marrow to temporarily stop producing new blood cells. This is almost always caused by a parvovirus B19 infection. The accelerated breakdown of blood releases substances that form gallstones. These gallstones can end up in your bile ducts and block the gallbladder passage, which can cause severe abdominal pain. The retina in your eye may get damaged by the regular vessel blockages and episodes of low oxygen levels. Your eyesight may be impaired as a result. This may occur from the second half of your teenage years and deteriorate over the years after adolescence. When you have an appetite for unusual things that are not really edible, you are suffering from a disorder that is called pica. You may then have a craving for various unusual things such as paper, earth, hair, etc. This is because it is caused by a shortage of certain nutrients or because you are sick and do not feel well. Pica can cause abdominal pain and be bad for your teeth. The things you end up eating can also be unhealthy. Children who have sickle cell disease are often shorter and thinner than children who do not have the disease. This is because the conditions for your body are not ideal for growth. It is therefore important that you eat sufficiently and healthy. Puberty development will also be slower. Children with sickle cell disease tend to start puberty 2 years later than their peers. Wounds generally do not heal as easily. In adulthood, sickle cell patients may suffer open infections, mainly on the lower legs, which take longer to heal or do not heal properly. When blood vessels in the penis clog up, you may suffer a persistent and painful erection. This is what we call priapism.